Good morning and welcome to DentistChannel.Online. I'm Dr. Aparna Pandya and with me today is Dr. Jaspreet. Dr. Jaspreet has done her BDS from Sri Guru Ramdas Institute of Dental Science, Amritsar in 2017 and joined BDS in 2021. Right now, she's in the last year of BDS program at University of Pacific Author School of Dentistry. Thank you, doctor, to take out the time and be with us today. Over to you.
Hi, Doctor. Hello, everyone. So, as Dr. Aparna introduced myself, so I am Dr. Jasdeep Karchima, and today I'll be sharing a little bit about my experience of my journey towards DDS, and also what all the options foreign graduates have in United States and Canada. And yeah, we can begin it. So I'll be sharing my screen. Just give me one moment. All right, guys. So are you able to see my slides?
Yes, I can see your slides.
Okay. All right. So let's begin. So as Dr. Aparna told everyone that I am DDS candidate in class of 2023 at University of the Pacific Arthur A. Dagoni School of Dentistry, and it is located in San Francisco, United States. Well, it was never easy to be here, to reach here. I faced so many problems. So I really, it was so difficult to walk alone blindly. So here I am to guide you all towards all the different pathways you guys have in the United States or in Canada. So first of all, welcome on board and thank you everyone for joining me. And we'll begin with United States. So in United States, if you're a graduate from foreign country, so in United States, you have like three different options. I would say the main three different options. First of all, you can always pursue MPH, which is Masters in Public Health, or Preceptorship and fellowships. Secondly, you can pursue dental residency. And for dental residency, there are two steps. First of all, you need to clear some exams like GRE, and some universities also require you to do national dental boards, but it's not mandatory. Mostly it is GRE, which is required, and TOEFL, which is English examination. And then once you are done with these examinations, you can always apply to different schools and they will call you for interviews. And some schools also ask you for bench exams, but mostly for residency, it's interview. And once you get selected, it depends upon the specialty. It's 2 years or 3 years program. And the third option is International Dental Program, which is DDS. And it also have like two steps. In first step, you have to give examinations. Earlier, when I gave examination, it was the National Dental Boards Part 1 and Part 2. But right now, it is Integrated National Dental Board Examinations. And after that you also have to clear TOEFL. And once you are done with these two examinations, you can start applying to different dental schools, and I will explain you the full process, how you can apply, and where you can go, and all those websites. And they're like, most of schools also want you to give a bench exam. There are a couple of schools which don't require bench exam and it's just interview, but mostly schools require you to give bench exam. And once you nail it, you are into the dental school, and depending upon the school, it can be 2 years or 3 years program. Also, I want to mention over here, if anybody have any questions, you can always, leave in the chat box or Q&A session, and I will be happy to answer you guys. And also let me know if I'm like too fast or, if it's fine. All right. So let's begin with the preceptorship and fellowship. So these are the major universities which will offer international graduates preceptorships and fellowship programs. So UCSF have really good program in perio and ortho. University of Florida has like multiple a program in multiple specialties. Fellowships in multiple specialties, and then University of Minnesota have in oral biology. Tufts have in aesthetics, dentistry. So and these the couple of universities which also have preceptorships. So fellowships and preceptorships are like if you want to gain like more experience before you start practicing, or if you are improving your resume to get into international dental programs. So these are like really helpful in those. Now let's begin with our main topic, which is dental residency or international dental program and international dental program. So the beginning of both of these, like the process is same, but then after like some steps, it's gonna be like different for both. So first of all, what you have to do is you have to create a dent pin. Dent pin is like a unique ID which American Dental Association will provide to all the students who want to pursue either residency or DDS program in the United States. And I have also provided you the link to go to the website so that you can, it's just you have to fill in your information and they'll provide you the ID. So once you have your dent pin, you can start your ECE evaluation. So ECE evaluation is like evaluation of your degrees. So this I've also mentioned the website www.ece.org. So you can go to this website and you can request a journal report in which you have to select course by course evaluation, and they will also ask you for the documents which you have to bring for your from your university. So once you have applied and you have paid the fees, you will receive a receipt in which there'll be instructions for all the documents they require. So what I remember is they require you to have your like transcripts. I think it's your from first year to final year, your all of your DNCs, and then your internship completion certificate, which you have to take to the university, and then they'll give you a transcript. So once you get it, you have to post it to ECE, and in a couple of days you can always choose for rush services if you want to get it done soon. Otherwise, I think it's gonna take around 45 days, and in rush services it's like a little bit faster. So once you apply for it, and you also have to select the like report to be sent to your testing department, to the National Dental Board's testing department. So the report will be automatically sent to the department, and once testing department get your report, you can go ahead and book an appointment for your test. And in United States, the best part is you can once you get your report, you are eligible to apply for test, and you can choose the date whichever you are like which is convenient to you. It's not that like in Canada the test is conducted like just twice or thrice a year, but in the United States, whenever you are done with your evaluations and everything, you can choose the date which you want, and you will get it. Like I think they conduct tests like every month, almost like every other day. So yeah, it's really easy. And I'll also have mentioned the website to for everything. You can note down these websites. Then coming on to TOEFL. So TOEFL it's not hard at all. But yeah, it's a bit tougher than IELTS examination, and you have to be a competitive like applicant to apply to dental school. You have to score more than 100. I mean, that's what I would recommend, that more than 100 is always what the school is looking for. So some school also write that above 90 they're fine, but I think 100 is something which they think is like your competitive applicant. So to prepare for TOEFL in India, you won't, I'm not sure about other countries, but in India, it's like really difficult to get a proper coaching center for TOEFL. And mostly the teachers who are teaching for IELTS, they teach for TOEFL. So I mean, they are not that much trained to teach you about TOEFL. So it's better to use these resources which I've mentioned. So you can always opt for at-home preparation, and then at home, that's what I choose. And these are a couple of resources like TOEFLresources.com, Noteful.com, bestmytest.com, and TOEFLteachers.com. So these are all good resources, and you will also get some free trials. That's what I opted for. I just opted for free trials, and I got my I was able to prepare for it. But you can also opt to get your essays and stuff checked by the professional teachers who are trained to for TOEFL, and I think it's not that expensive as well. And as I was mentioning earlier as well, in like coaching centers are not that well trained, but you can always opt to buy online classes from these particular websites. Now, coming up on to National Dental Part 1 and Part 2 and versus integrated National Dental Boards. So right now, you guys will be giving integrated National Dental Boards. When I gave my examination, it was Part 1 and Part 2. And I would say that INPTE is much better. I mean, it's just one go. You just have to give an exam, and I mean, you don't have to be appearing twice for examinations. And I mean, they ask more clinical questions like they used to ask in Part 2. So I have not given this exam, but I have talked with a couple of my friends and who have given integrated national dental boards, and I think I just find it better. So there are a couple of resources you can always, which are like main resources for you to prepare for national dental boards. So dental decks, I would say, is the best. That's what I read. And first aids. These are two things when I was preparing, I read. And then there are other things like Mosby, Kaplan's, which you can always refer to if you are not able to understand something. I mean, because in Mosby and Kaplan the stuff is in more detail. In first aid and dental decks it's like more concise, but mostly the exam is if you know dental decks, you'll be able to get through your exam. And also there are a couple of Facebook groups. You can always search for National Dental Board study groups and stuff like that, and you can find a study partner, as well as you can find resources over there to prepare for the exam. Now coming upon to once you have cleared the examinations, national dental boards, and you're done with TOEFL, you can start with your CAPED application. CAPED application, I've given the link for the website. So it is an application where you can apply to all different schools in the United States. I mean, once you start making your profile, you will have to add all your information, like your about your school, about the volunteer experience you did. I would say that you must include the awards or anything you got, like it can be any extracurricular activity or anything, or any CE courses, whatever special you have in your profile and your resume. Just keep on adding into the experience section of CAPED. And once you're done with your CAPED application, you can apply to schools. But be very mindful. First, you should go to the websites of different schools and read that what are their requirements, because some of the schools, they prefer green card holders or citizens, and if you are not a green card holder, you're like on a visa like me, so then I would say that it wouldn't be a good idea to apply into that schools, because there are many people applying, and it'll be just, I mean, I think that it won't be worth it. So it's better to read that which school your profile fit into, and then apply. And then, all right. And then let's talk about residency. So in residency, you don't apply to CAPID, but there's another website that is ADEA Pass for residency. So similar to the CAPID, it's ADEA Pass. So you have to make your profile similarly like you make in CAPID, and you can always look up for the schools you want to apply. Now let's talk about something like, people always say that there's a lot of wait once you clear national dental boards. When I was in India, when I was in dental school, I used to hear this word, this line a lot, that we should not, it's gonna take a long time to get into dental school in United States, and that there's a long like wait, and what is this wait, and why you have to wait. So the reason for the wait is that on average, every dental school in the United States have like 15 to 20 seats. Some schools have 5, some have 30. So it depends upon different schools. So and the applicants are like 800 to 1200 applying to one school, and these are like all experienced dentists from all over the world. And if you're an Indian applicant, you will face like even more difficulty, because 80% of applicants are Indians. Just a second. I'm sorry, guys, for making you wait. So mostly applicants are Indian. So it'll be 80% Indian applicants, and schools will prefer diversity for sure. They're looking for applicants from all over the world. So you have to really make your application like different from everyone. You have to show that you are a unique applicant, that you are not like everyone in the crowd. So for that, you can show your CE courses you have attended, the work experience you have in India or in the United States, and the research experience or any volunteer experience you have done. And I would say that United States experience matters a lot. It really does matters a lot, because some of the universities have clearly mentioned, like Indiana Dental School, if you apply, I'm not sure right now what is their requirement, but when I was applying, they were asking for at least 400 United States volunteer hours just to be eligible to apply to the school. So you have to make sure that you're applying to the school where you fit into the requirement. And if you have 400 volunteer hours, for sure go for Indiana. But if you don't, I won't say that it's a good idea to apply there. And then there are a couple of dental schools like USC, Herman Oster School of Dentistry, which only call master's candidate for interviews. I applied over there, and then I realized that mostly they're calling master's candidate. Masters, I'm talking about the residency from India, like periodontics or oral surgeon. They're not even accepting the masters like MPH or anything like that. Masters in dentistry. And then obviously you have to show that you are unique and you're deserving out of rest of that 800 applicants fighting for same spots as you are. Now coming upon to, once you suppose you get an interview, you apply to dance schools, and then most of dance schools, as I told you, have bench examinations as well. So I would say that there are a couple of good bench prep courses which you can take. In India, there's ODA Achievers, which is in Chandigarh. I have not been to ODA ever, but I know that I have many of my classmates who have been to ODA, and and they have cleared bench, and they have given really good reviews about it. And then I personally went to Dr. Stevenson's Dental Solution, which is in LA. It's a really good course. I really loved this course, and Dr. Stevenson is like really good. And then there's another course, Dr. Duggan's Dental Solution. It is also in LA, and I have also a couple of my friends have been to this course, and they have told me that it's a really good course. So yeah, these are the good places where you can go and prepare for your bench. And most of the schools, they ask for class 2, and it's mostly maxillary first molar class 2, MO, mostly MO. And then they'll ask you for a crown prep, and a crown prep can be any, like it can be all ceramic, it can be a full gold, or it can be PFM. I remember University of the Pacific asked us full, I think full, not all ceramic on number 9. So by number 9 I mean first in 1-1. And there are a couple other school which will ask you about the case-based discussions and questions. So they'll give you a case about a patient, and they'll give you that this is the medical history of the patient. And UCSF does that, like I remember. So they'll give you a medical history of a patient, and then you will have to tell them that what you will do in this case. And there are a couple of schools which will give present a proper case on a board, and on a PPT, and they'll show you like all the x-rays and clinical pictures of a patient, and then you have to talk about your treatment plan for that patient. And there are a couple of other schools which will ask you for wax carvings, onlay prep, and I think Buffalo's also ask you about class 2 restoration. Usually the other schools ask you about class 2 prep only, but Buffalo also asks you about the class 2 restoration. But you can always be up to date with these requirements when you are searching online about the school. You can also see what this particular school is asking about. It'll be all mentioned on the website. And then couple of interview tips. So in interview, it's nothing like I still remember my Pacific interview. It was one of the best interview in the world. They'll treat you like really, really a nice way, and it is just like talking with the interviewer. It's not like they're kind of interrogating or asking you something. It's nothing like that, but they're talking with you. But these people, these professors, are experienced so much. Like the professor with whom I had an interview was interviewing students since 52 years. He was into the school, into the Pacific since 52 years. So they really, really can catch you. They're really, if you're lying. So be yourself. First of all, be yourself. And then try not to lie about anything. Be very truthful about what you have done. They're not going to see your certificates. Mostly they're not going to see your certificates. But they can ask. I'm not sure, but I was never asked about any certificates. But they can make sure by the interview that whether you're lying or whether you're being truthful. And then your dress up should be a business attire, and practice. I would say practice with your friends, with your teachers, whoever you can. And also I do have some sample questions. If you guys want, I'll share my email at the end of the PPT, and you can always drop me an email and I can send you the sample questions. So these are a couple of the websites you can always refer to for your it'll be really good friends in your journey towards your dental residency or international dental program. So you can note these websites down. There are Facebook groups as well, so where you can go and find a study partner or interview, or you can prepare interview with them. Now moving on to Canada. So in Canada, there are basically two pathways to I mean, there are basically two pathways which you can follow. First is the equivalency process, in which you can always you have to give particular exams, and then you can start if you want to practice, you can start practicing and stuff. But there's another pathway, like degree, in which you have to go to dental school, like in United States. So first of all, you will have to get your degree evaluations and done, verifications done, which in Canada it takes like more than a month, usually 3 months. So you can start, go to the NDEB website, and you can make your profile, and you can start with this, so that you can get your verification done. And once you complete the application, they'll ask you to send the transcript. So similarly, you have to take your transcripts from your university, and then you can send it to them. And once it gets approved, you can apply for the test. And it's not like in like I told you, in the United States, you can always apply for test, and you can get it, like do it, give it whenever you're ready. But over in Canada, they're like, I think they conduct it twice or thrice a year. And you have to be prepared by the time you're thinking, I think it's in March and in August. So you can always look up online. But that's how it was. And then after giving AFK, which is assessment of fundamental knowledge, which is like similar to INDBE, so you can opt for two different pathways. Like you can go to a dental school, like in United States. But for this, you have to have really good percentile, like to get selected into the dental school. You have to have really good percentile in AFK. It's not like in the United States. In the United States, just pass or fail. But in Canada, they'll give you a percentile. Or you can go to, you can do the ACJ, which is assessment of clinical judgment, and ACS, which is assessment, and after that ACS, which is assessment of clinical skills. These are like a practical examination in which they ask you about 6-7 different, like you have to perform a class 2, a crown, and similarly make a temporary crown, and do a restoration. There are like almost 6 disciplines you have to do. And then if you like clear this exam, you can give you can you get certified in as a NDEB. And Canada have like another thing, which is for master's candidate only. So this is the process. If you have done specialty from any foreign country, you can always opt for the given tests and examinations, like DSCKE and DEB, and then DSATP, and this is the pathway if you want to opt for residency. But again, there is a lot of competition and very few spots. So you have to look up, on your profile, like, what you want to do, like. And well, that's pretty much it about, pathways in the United States and Canada. I know it seems like a lot, when I talk about it, but yeah, where there's a will, for sure there's a way, and nothing is impossible. If you want to do something, you will, you have to work for it, you will achieve it, like, this it's and yeah, it appears blurred, like now, you'd be like, she's talking so much, like, you can do this, you have to go to this website and stuff like that. Once you start it, you will be able to do it. You need to have that willpower that, yeah, I can do it. you'll be able to do it. And also I want to share about my share my email address with you guys. You can note it down. I've written it over here. I can also spell it out for you. It's j_chema CHEEMA number 2 at u.pacific.edu. And I will also mention my Instagram account, so you can always feel free to drop me a question, and I'll whenever I get time, I'll for sure try to answer all your queries. And I mean, I would be happy to help you guys. I mean, as I told you, I know how it feels to be, walking into that pathway alone. I have experienced that. I mean, I won't. There were a couple of really good, seniors or mentors who helped me out through it, and I want to be same. So just drop me questions whenever you feel like. And at the end, any questions, guys? If you have any questions, you can ask me.
Thank you, Dr. Jaspreet, for this wonderful presentation.
You're
Before we
welcome.
take up the questions, I'll just show you the company presentation. So online dentistry is the first digital dentist media, and we provide services to both dental professionals as well as dental organizations, catering all your needs, academic and professional. We provide dental news, webinars, courses, events, premium videos, clinic ID services, Prime membership. You can submit scientific articles, dental business. You can contribute videos, buy and sell. And for dental organizations, we host events, graphic designing is done, social media assistance is provided. All the participants will be given certificate. There is event registrations, consultation services, content writing. You can list your business or advertise with us. So more than 700 live dental webinars have already been published, and there are more than 25 plus dental workshops. There are more than 400 participants, 400 national and international speakers, 300 plus oral care videos under Save the Truth. Also, DentistChannel.Online has been certified with maximum speakers participating in virtual dental program on oral implantology in India Book of Records. So this is the benefits of being a Prime member. You will get a personalized account, and you can access all the webinars organized by the DentistChannel.Online. There'll be special discount on dental courses, certification with CPD, CDE points, and you can easily download the certificates. You'll get regular updates about dentistry. You can access various scientific articles, participate as a speaker, or publish public awareness videos. So all the participants will be getting a certificate of participation. And if you join as a Prime member, it's $7.99 per year, which is equivalent to $10 USD. And if you use the promo code AP100, you will get assured discount. So these are our upcoming webinars. Thank you so much for your time. And Dr. Let's see if we have any questions.
Yeah,
so,
sure.
Bhavish says that it's an awesome session. If I don't have anyone in us, how can we get financial support like money or scholarship?
Okay, so I mean, particularly for international dental program and dental residency, you won't get any scholarship. I mean, yes, for other programs you will get scholarship, but particularly for these two, I mean, you can be like the best in India or anywhere, but they won't give you a scholarship because you're not eligible for scholarship in these programs. But you can always opt for private loans. And suppose usually we need a co-signer to get a loan. But suppose if you don't have anyone in the United States who can co-sign a loan for you, there are two options. First of all, you can always opt to take a loan from India. I think HDFC Bank will provide you loan, but yes, interest rate is higher than what you will get in the United States, and I mean it's a lot of hassle to get a loan passed from India. Like you have to show a lot of stuff. But then if you are planning to get a loan from United States, you can also get it from, there are a couple of private banks which will provide you loan without a co-signer. And I can always I mean, I am not sure about the right now I don't have complete information about these banks, but I know my classmates who have done this process, and I can always get the information about these banks, and I can always, you know, just drop an email and I'll let you know. But yes, there are a couple of banks which will provide you private loan without a co-signer. But yeah, interest rate will be for sure a little bit higher than the usual uh, you know, bank will provide you.
Okay, thank you so much. One more question from Bhavesh. Um, so he wants to pursue oral surgery and practice in US, but he has heard that he can directly do residency in US. Is it true, or should he do DDS and then do residency in US?
Well, there are a couple of residency programs where you can directly apply. I'm not sure about oral surgery yet. I think you have to do a DDS to apply for it. But again, you can or you can do a fellowship in oral surgeries, and then, you know, you can apply for it. I mean, there is also masters in oral surgery where you can directly apply to. But let me confirm this with someone, and then of course just email me and I'll reply you back. I'm not sure about oral surgery. There are a couple of residencies, like you know, you can go to Ontario. There are a couple of other AGDE programs as well, which UCLA offer, but those are in conservative dentistry. I mean, I'm not. Yeah, let me just make sure that, you know, I'm giving you right information. I think so. You can't do an oral surgery directly, but let me, you know, yeah.
Okay, and there's a question that should we carry our own instruments for exams?
Yeah, you can carry a couple of things, but there's, I mean, it really depends upon where you're going for a bench. Some of the universities let you carry your instruments. Some of universities, like University of the Pacific, don't let you carry anything of your own. I mean, you will have to use what they provide you. Also, Loma Linda University, because there are a couple of universities where I went for interview, so they will provide you like almost everything. Like you don't have to take anything, but yeah, there are a couple of universities which will let you. UOP and UPSC are not the one, because I have been there. I've been to UOP, I've been to University of San Francisco, California, and then I've been to Loma Linda. So they won't let you take your own stuff.
Okay. Thank you so much, Doctor, for this wonderful presentation. It's been a pleasure to have you with us.
You're very welcome. Thank you. Thank you, guys.
Thank you so much.